If you've been struggling with muscle soreness that just won't go away, or if you wake up feeling stiff and tired even after a full night's sleep, what I'm about to share could completely change how your body recovers. Most people have no idea that the vitamins and nutrients they take during the day might be doing absolutely nothing for their muscle recovery, simply because they're taking them at the wrong time. And for those over 60, this timing issue becomes even more critical, because our bodies naturally lose the ability to repair muscle tissue as efficiently as they once did. I'm Dr. Susan Miller, and I've been working in sports medicine and geriatric health for over 15 years. Throughout my career, I've seen thousands of patients who complained about chronic muscle pain, weakness, and slow recovery, only to discover that their nighttime nutrition was completely overlooked. The truth is, while you sleep, your body enters the most powerful recovery mode it has all day, and if you're not providing the right building blocks during this crucial window, you're essentially wasting 8 hours of potential healing. Before we dive in, if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. If you enjoy this video, please leave your questions and suggestions in the comments below. I read every single one, and it helps me create more content to help people just like you. Now, let me share something that happens in my clinic almost every week. Just last month, I met Mr. James Thompson, a 72-year-old retired teacher from Austin, Texas. James had been an active man his entire life. He played tennis twice a week, gardened every morning, and took daily walks with his wife, Patricia. But over the past year, something changed. He started waking up with severe muscle stiffness in his legs and shoulders. The soreness was so intense that some mornings he could barely get out of bed without his wife's help. He told me, with tears in his eyes, that he felt like his body was betraying him. He'd been taking a multivitamin every morning with breakfast, eating what he thought was a balanced diet, and staying active, but nothing seemed to help. When I asked him about his nighttime routine, he looked confused. He said nobody had ever mentioned that what he did before bed could affect his muscle recovery. That conversation changed everything for him. What James didn't know, and what most people don't realize, is that muscle repair happens primarily during deep sleep. When you're in those deep sleep stages, your body releases growth hormone, which is absolutely essential for muscle recovery and tissue repair. But here's the problem. Growth hormone can't do its job effectively if you don't have the right nutrients available in your bloodstream during those nighttime hours. Think of it like trying to build a house without having the bricks, cement, and tools delivered to the construction site. Your body wants to repair your muscles, but if the raw materials aren't there, the repair process slows down dramatically, or doesn't happen at all. The first nutrient that becomes absolutely critical for nighttime muscle recovery is magnesium. Now, I know you've probably heard about magnesium before, but let me explain why taking it at night specifically makes such a profound difference. Magnesium is involved in over 300 biochemical reactions in your body, and one of its most important roles is helping your muscles relax after contraction. During the day, when you're moving around, exercising, or even just doing daily activities, your muscles are constantly contracting. Those contractions create tiny tears in the muscle fibers, which is completely normal. The problem occurs when those muscles can't fully relax at night, because without adequate magnesium, the muscle fibers remain in a state of partial tension, which prevents proper healing and leads to that morning stiffness so many people experience. Let me tell you about Mrs. Carmen Rodriguez, a 68-year-old former nurse from Miami, Florida. Carmen came to see me because she'd been experiencing terrible leg cramps at night. These cramps were so painful that they'd wake her up 2 or 3 times every night, leaving her exhausted the next day. She'd tried stretching before bed, staying hydrated, and even bought a new mattress, thinking maybe that was the problem. Nothing worked. During our consultation, I learned that Carmen had been taking a calcium supplement every evening because her previous doctor recommended it for bone health. That's not a bad recommendation on its own, but here's what nobody told Carmen. Calcium and magnesium work together, and if you take too much calcium without enough magnesium, you can actually make muscle cramps worse. Calcium causes muscles to contract, while magnesium helps them relax. Carmen was essentially loading her body with a contraction signal right before bed, with no relaxation signal to balance it out. I recommended that Carmen start taking 300 to 400 milligrams of magnesium glycinate about an hour before bed. Within just 4 days, her nighttime leg cramps disappeared completely. She called my office crying, saying she'd finally gotten her first full night of sleep in over a year. 2 months later, she reported that not only were the cramps gone, but she was waking up with less overall muscle soreness and had more energy throughout the day. Her daughter told me Carmen was like a different person, back to playing with her grandchildren and even talking about returning to volunteer work at the hospital. If you're still watching and finding this information helpful, comment the number 1 below to show me you're following along. I love seeing your engagement, and it tells me which topics matter most to you. But magnesium is just the beginning. The second crucial nutrient for nighttime muscle recovery is vitamin D. And this one surprises people because they often think of vitamin D as something related only to bone health or immune function. But vitamin D plays a massive role in muscle function and recovery. Your muscle cells have vitamin D receptors on them, which means they're specifically designed to respond to vitamin D. When vitamin D binds to these receptors, it helps regulate muscle protein synthesis, which is the process your body uses to build and repair muscle tissue. Without adequate vitamin D, this process becomes sluggish and inefficient, leading to weakness, increased soreness, and longer recovery times after physical activity. Here's something most people don't know. Vitamin D levels naturally drop during the night and are lowest in the early morning hours. If you're only taking vitamin D in the morning, you might be missing the opportunity to support muscle recovery during those critical nighttime hours. I usually recommend taking vitamin D with your evening meal or about 2 hours before bed, especially if it's vitamin D3, which is the most effective form for raising and maintaining blood levels. Let me share the story of Mr. Robert Chen, a 75-year-old retired engineer from San Francisco, California. Robert had always been proud of his independence. He lived alone, managed his own home, and walked to the grocery store 3 times a week. But he started noticing that his legs felt weak, especially when climbing stairs or getting up from a chair. He'd sit down to watch television, and when he tried to stand up, his legs would feel wobbly and unreliable. His daughter, who's a physical therapist, became worried after Robert nearly fell while getting out of his car. She insisted he come see me for a complete evaluation. When I tested Robert's vitamin D levels, I was shocked. His levels were at 17 nanograms per milliliter, which is severely deficient. Normal levels should be at least 30, and optimal levels for muscle function are typically between 40 and 60. I asked Robert about his routine, and he told me he took a vitamin D supplement, but only sporadically, maybe 3 times a week in the morning when he remembered. I explained to Robert that consistency matters enormously with vitamin D, and that taking it in the evening might help his muscles recover better overnight. I started him on 2,000 international units of vitamin D3 every evening with dinner, along with checking his levels every 8 weeks to make sure we were moving in the right direction. The change in Robert was remarkable. After about 6 weeks, he told me the weakness in his legs had improved significantly. After 3 months, his vitamin D levels had risen to 48, and he said he felt stronger than he had in years. He was climbing stairs without holding the railing, getting up from chairs without using his arms for support, and had even started doing light resistance exercises at home. His daughter sent me a thank you card saying I'd given her father his confidence back. But I reminded her that Robert did all the work by committing to taking his vitamin D consistently every single evening. Now, if those first 2 surprised you, this next one is going to really change how you think about muscle recovery. The third essential nutrient for nighttime muscle repair is zinc. Most people associate zinc with immune function. And while that's absolutely true, zinc is also critically important for muscle recovery because it's directly involved in protein synthesis and cell division. Remember, when your muscles repair themselves, They're essentially building new cells and new proteins to replace the damaged tissue. Without adequate zinc, this repair process slows down dramatically. But here's the tricky part. Zinc levels in your body naturally decline with age, and many common medications further deplete zinc. If you're taking blood pressure medications, diuretics, or acid-reducing medications for heartburn or reflux, your zinc levels might be much lower than you think. And just like with the other nutrients I've mentioned, taking zinc at night allows it to be available during those crucial hours when your body is doing most of its muscle repair work. Let me tell you about Mrs. Linda Patterson, a 66-year-old retired librarian from Portland, Oregon. Linda was an avid hiker who loved exploring the trails around Portland with her hiking group every weekend. But she started noticing that after her hikes, her muscles would stay sore for 4 or 5 days, sometimes even a full week. She told me it used to be that she'd feel a little sore the next day, but by day 2 or 3 she'd be back to normal. Now she was skipping hikes because she was still recovering from the previous week. She'd tried foam rolling, massage, ice baths, and every recovery technique she could find online, but nothing seemed to make a real difference. During our conversation, I learned that Linda had been taking omeprazole, a medication for acid reflux, for over 3 years. I explained to her that long-term use of acid-reducing medications can significantly lower zinc absorption, which could be affecting her recovery. We ran a comprehensive blood panel, and sure enough, her zinc levels were in the low end of normal, which for someone as active as Linda wasn't adequate. I recommended she start taking 15 milligrams of zinc glycinate about an hour before bed, and I also worked with her primary care doctor to see if we could reduce her omeprazole dose by addressing her reflux through dietary changes. Within 3 weeks, Linda noticed a difference. She went on a moderate hike on a Saturday, and by Tuesday, she felt completely recovered. By the 6th week, she told me she felt like she'd turned back the clock 5 years. Her recovery time after hikes had shortened dramatically, and she was even able to increase the difficulty of her hikes without the prolonged soreness she'd been experiencing. She brought her entire hiking group to a health fair I spoke at, telling everyone that addressing her zinc levels at night had been the missing piece in her recovery puzzle. Her friends were amazed because they'd all watched her struggle for over a year, trying everything to feel better. The fourth nutrient that becomes essential for nighttime muscle recovery is omega-3 fatty acids. Now, I know omega-3s are famous for heart health and brain function, but they're also powerful for reducing muscle inflammation and supporting muscle repair. When you exercise or even just go about your daily activities, you create microscopic damage and inflammation in your muscle tissue. This inflammation is part of the natural healing process, but if it becomes excessive or chronic, it actually slows down recovery and increases pain and stiffness. Omega-3 fatty acids, particularly EPA and DHA, help regulate the inflammatory response in your muscles. They don't eliminate inflammation completely because some inflammation is necessary for healing, but they help keep it at a healthy, productive level rather than letting it spiral into chronic, damaging inflammation. Taking omega-3s before bed means they're circulating in your bloodstream during those critical overnight hours when your body is actively working to repair muscle tissue. Let me share the story of Mr. George Williams, a 70-year-old retired firefighter from Chicago, Illinois. George had lived a physically demanding life. 30 years of carrying equipment, climbing ladders, and responding to emergencies had taken a toll on his body. In retirement, he tried to stay active by walking and doing light exercise, but he was constantly battling muscle soreness and stiffness, particularly in his shoulders, back, and knees. He described the pain as a constant ache that never quite went away. He'd wake up stiff, and throughout the day, the stiffness would ease slightly but never disappear. By evening, he'd be exhausted from dealing with the discomfort. George had tried over-the-counter pain medications, physical therapy, and even acupuncture, all with limited success. When he came to see me, I could see the frustration on his face. He said he felt like his body was falling apart, and he was too young to feel this old. During our evaluation, I asked about his diet, and George admitted that he rarely ate fish and had never taken an omega-3 supplement. Given his history of physical stress on his body and the chronic inflammation he was experiencing, I strongly recommended he start taking a high-quality fish oil supplement providing at least 1,000 milligrams of combined EPA and DHA, taken with his evening meal. I also explained to George that omega-3s can take a bit longer to build up in your system compared to some other nutrients, so he needed to be patient and consistent. After about 4 weeks, George called my office to say he thought he might be noticing a small improvement. By 8 weeks, the improvement was undeniable. He told me the constant ache in his shoulders and back had decreased by about 60%. His morning stiffness was still there, but much less severe, and he was able to do his daily walks without the heavy fatigue he'd been experiencing. At our 3-month follow-up, George looked like a different person. He was smiling, standing straighter, and told me he'd even started doing some lightweight training at home. He said for the first time in years he felt like his body was working with him instead of against him. If you're finding these stories relatable and this information valuable, please leave a comment letting me know which of these nutrients you think might be missing from your nighttime routine. Your feedback helps me understand what content serves you best. The 5th crucial nutrient for nighttime muscle recovery is vitamin C, but not for the reasons you might think. Most people know vitamin C is important for immune function, but vitamin C is also absolutely essential for collagen production. And collagen isn't just something that keeps your skin looking young. It's a critical structural protein that makes up a significant portion of your tendons, ligaments, and the connective tissue that holds your muscles together. When your muscles repair themselves after activity or exercise, they need to rebuild not just the muscle fibers themselves, but also all the supporting connective tissue. Without adequate vitamin C, this collagen synthesis can't happen efficiently, leading to longer recovery times and increased risk of injury. Taking vitamin C before bed ensures that your body has this crucial nutrient available during the overnight hours, when muscle repair is at its peak. Some research even suggests that vitamin C taken before sleep might help reduce muscle soreness after exercise, though individual results can vary. I typically recommend between 500 to 1,000 milligrams of vitamin C in the evening for people focused on muscle recovery. Let me tell you about Mrs. Angela Santos, a 64-year-old yoga instructor from San Diego, California. Angela had been teaching yoga for over 20 years and had always prided herself on her flexibility and strength. But about 18 months before she came to see me, she started developing persistent pain in her shoulders and elbows. At first, she thought maybe she'd overdone it with her practice, so she took a few weeks off. But when she returned to teaching, the pain came back even worse. She also noticed that her muscles seemed to take forever to recover after her classes. She'd teach a morning class and still feel exhausted and sore by evening, which had never happened before. Angela was frustrated because her livelihood depended on her physical health, and she was worried she might have to stop teaching, which would have been devastating for her emotionally and financially. When I evaluated Angela, I noticed that despite being a health-conscious person who ate well and took care of herself, her vitamin C intake was actually quite low. She'd stopped eating citrus fruits years ago due to acid reflux issues, and while she ate some vegetables, she wasn't getting nearly enough vitamin C for her activity level and age. I recommended Angela start taking 750 milligrams of vitamin C every evening, along with the magnesium we also added to support her muscle recovery. I also suggested she might want to add some low-acid vitamin C-rich foods to her diet during the day. Within about 3 weeks, Angela reported that the persistent pain in her shoulders and elbows had started to ease. By 6 weeks, she said her recovery after teaching had improved dramatically. She could teach a morning class, handle her daily activities, and still have energy in the evening. At our 3-month checkup, Angela was back to teaching full-time without pain or excessive fatigue. She told me she felt like she'd gotten her career and her passion back, and she'd started recommending vitamin C supplementation to all her older students. Now, the 6th nutrient that often gets overlooked for nighttime muscle recovery is potassium. Potassium works closely with magnesium and is essential for proper muscle contraction and relaxation. it's also critical for maintaining proper fluid balance in your muscle cells. When potassium levels are low, muscles can become weak, crampy, and slow to recover. The challenge with potassium is that many older adults don't get enough through their diet, and certain medications, particularly diuretics used for blood pressure or heart conditions, can deplete potassium significantly. Unlike the other nutrients I've mentioned, I'm generally cautious about recommending potassium supplements because too much potassium can be dangerous, especially if you have kidney problems or take certain medications. Instead, I usually recommend getting potassium from food sources in the evening. Foods like bananas, sweet potatoes, avocados, spinach, and white beans are all excellent sources. Having a potassium-rich evening snack or including these foods in your dinner can provide the potassium your muscles need for overnight recovery. Let me share the experience of Mr. David Martinez, a 69-year-old retired postal worker from Denver, Colorado. David had been experiencing severe muscle weakness and fatigue for months. He'd wake up feeling drained, his legs would feel heavy throughout the day, and he'd developed occasional heart palpitations that worried him. His primary care doctor had started him on a diuretic medication for mild high blood pressure about 8 months earlier, and that's when his symptoms began, though David didn't make the connection at first. When David came to see me, I immediately checked his potassium levels because I knew his diuretic medication could be depleting this crucial mineral. Sure enough, his potassium was low, not dangerously low, but definitely low enough to cause his symptoms. Rather than adding a potassium supplement, which can be tricky to manage safely, I worked with David and his primary care doctor to adjust his blood pressure medication, and I taught David how to incorporate more potassium-rich foods into his diet, particularly in the evening. I recommended he have a banana with almond butter as an evening snack, or add a sweet potato to his dinner, or make a smoothie with spinach and avocado. David was skeptical at first. He couldn't believe that something as simple as changing his evening snacks could make a difference, but he trusted me enough to try it consistently for a month. The results amazed him. Within 2 weeks, his energy levels started improving. The heavy feeling in his legs began to lift. By 4 weeks, the heart palpitations had stopped completely, and he was waking up feeling refreshed instead of exhausted. David later told me that this experience taught him just how powerful the right nutrition at the right time can be. He'd been taking his morning multivitamin for years and thought that was enough, but it was the specific nutrients in the evening that his body desperately needed for recovery and proper function. The seventh and final nutrient I want to talk about for nighttime muscle recovery is actually a combination: B vitamins, particularly B6 and B12. These vitamins play crucial roles in energy production at the cellular level and in the metabolism of amino acids, which are the building blocks of muscle protein. Vitamin B6 is involved in over 100 enzyme reactions in your body, many of which are related to protein metabolism and muscle function. Vitamin B12 is essential for producing red blood cells, which carry oxygen to your muscles, and for maintaining the health of your nervous system, which controls muscle movement and recovery. As we age, our ability to absorb vitamin B12 from food decreases significantly, especially if we take acid-reducing medications. This can lead to a gradual decline in B12 levels over years, causing symptoms that develop so slowly people often don't realize anything is wrong until the deficiency becomes severe. Muscle weakness, fatigue, poor recovery, and even balance problems can all be related to B vitamin deficiency. Taking a B-complex supplement in the evening, or at least ensuring adequate B6 and B12 intake, can support the cellular energy production that happens during sleep and help your body efficiently use the amino acids from your evening meal for muscle repair. I typically look for a B-complex that provides at least 2 milligrams of B6 and at least 50 micrograms of B12 for people focused on muscle recovery. Let me tell you about Mrs. Helen Foster, a 73-year-old retired teacher from Boston, Massachusetts. Helen came to see me because she'd been experiencing progressive muscle weakness and extreme fatigue for over a year. She described feeling like her batteries had run completely empty. She'd wake up tired, struggle through the day, and by evening she could barely make it up the stairs to her bedroom. Her muscles felt weak and shaky, and she'd started using a cane because she was afraid of falling. Multiple doctors had run tests but hadn't found any clear explanation for her symptoms. She was starting to fear she had some serious underlying disease. During my evaluation, I asked Helen detailed questions about her medical history and medications. She'd been taking omeprazole for acid reflux for over 8 years and had also been on metformin for diabetes for about 6 years. Both of these medications are known to interfere with B12 absorption. I ordered comprehensive testing, and when the results came back, Helen's B12 level was shockingly low, well below the normal range. Her B6 was also on the lower end. I was honestly surprised her symptoms weren't even worse given how deficient she was. I immediately started Helen on B12 injections once a week for a month to quickly restore her levels, and then switched her to a high-dose oral B-complex supplement that she'd take every evening. The transformation was nothing short of miraculous. After just 2 weeks of injections, Helen called my office saying she'd started to feel like herself again. Her energy was returning, and the shakiness in her muscles was improving. By the time we switched to the oral supplement, her strength had improved so much she'd stopped using the cane. 6 months later, Helen was volunteering at her local library, taking walks around her neighborhood, and even traveling to visit her grandchildren out of state. She told me she'd accepted that feeling terrible was just part of getting older, but now she realized she'd been suffering from a completely treatable deficiency. Those B vitamins, taken consistently in the evening, had literally given her her life back. Now, here's something really important that I need you to understand. While each of these nutrients is powerful on its own, they work together synergistically, meaning they enhance each other's effects. Magnesium helps activate vitamin D. Vitamin D enhances calcium absorption, which needs to be balanced with magnesium. Vitamin C enhances the absorption of many other nutrients. The B vitamins work together as a complex. Zinc and magnesium support each other. Omega-3s reduce inflammation that can interfere with nutrient absorption and utilization. This is why addressing nighttime nutrition comprehensively, rather than just taking one supplement, often produces the most dramatic results. But I also want to be very clear about something. These nutrients should come from a combination of a healthy diet and targeted supplementation where needed. No supplement can replace a poor diet. Your evening meal should include quality protein sources to provide amino acids for muscle repair, vegetables for vitamins and minerals, and healthy fats to support nutrient absorption. Then, supplements can fill in the gaps and provide optimal levels of specific nutrients that are hard to get from food alone, or that your body needs extra amounts of due to age, activity level, or medications you might be taking. It's also absolutely crucial that you talk to your doctor before starting any new supplement regimen, especially if you take medications or have any health conditions. Some supplements can interact with medications. For example, magnesium can interact with certain antibiotics, osteoporosis drugs, and muscle relaxants. Vitamin K, which I didn't focus on today but which is also important for bone and muscle health, can interact with blood-thinning medications. Zinc can interfere with certain antibiotics. Your doctor needs to know everything you're taking to ensure your safety and to monitor for any potential interactions or side effects. What I've shared with you today is the culmination of 15 years of clinical experience and hundreds of patients who've struggled with muscle pain, weakness, and slow recovery. The pattern I've seen over and over is that people focus all their attention on daytime nutrition, daytime exercise, and daytime recovery strategies, while completely ignoring what happens during the 8 hours they're asleep. But those 8 hours are when your body does its most important repair work, and if you're not providing the right nutritional support during that window, you're essentially wasting the most valuable recovery time you have. Think about it this way. If you owned a repair shop that was only open at night, would you wait until morning to deliver the parts and tools your mechanics need? Of course not. You'd make sure everything they needed was available when they were actually working. Your body's muscle repair shop is open primarily at night, during deep sleep. That's when the mechanics are working. If you don't give them the parts they need during their working hours, they can't fix what's broken, no matter how much time you give them. The stories I've shared with you today, James with his morning stiffness, Carmen with her nighttime leg cramps, Robert with his leg weakness, Linda with her prolonged muscle soreness, George with his chronic aching, Angela with her shoulder pain, David with his fatigue and heavy legs, and Helen with her extreme muscle weakness. These aren't unusual cases. They represent the reality for millions of older adults who are struggling with muscle issues that could be significantly improved by addressing their nighttime nutrition. Every single one of these people had tried multiple other approaches before we finally identified that their nighttime nutritional status was the missing piece of the puzzle. Here's what I want you to take away from this video. Muscle recovery isn't just about rest. It's about providing your body with the specific nutrients it needs during the specific times when recovery is happening. Magnesium for muscle relaxation, vitamin D for muscle protein synthesis, zinc for cellular repair, omega-3s for inflammation control, vitamin C for collagen production, potassium for muscle function, and B vitamins for energy metabolism and protein metabolism. Each of these plays a distinct and crucial role in helping your muscles repair, rebuild, and strengthen overnight. If you're experiencing persistent muscle soreness, weakness, stiffness, slow recovery after activity, or frequent muscle cramps, I strongly encourage you to have a conversation with your doctor about your nighttime nutritional status. Ask to have your levels of these key nutrients tested. Many of them can be checked with simple blood work. And once you know where you stand, you and your doctor can develop a targeted plan to address any deficiencies or insufficiencies. Remember that changing your nighttime nutrition won't produce overnight miracles. Most of my patients started noticing improvements within 2 to 6 weeks, with continued improvement over 3 to 6 months as their nutrient levels stabilized and their bodies fully adapted. This is a marathon, not a sprint. But the payoff, better sleep, less pain, faster recovery, more strength, more independence, and better quality of life, is absolutely worth the commitment. I want to hear from you in the comments. Which of these nutrients do you think might be missing from your nighttime routine? Have you experienced any of the symptoms I've described? What strategies have you tried for muscle recovery, and what's worked or hasn't worked for you? Your stories and questions not only help me create better content, but also help other viewers who might be going through similar struggles. We're all in this together, trying to maintain our health and independence as we age. Before we finish, please hit that like button if you found this information valuable, and subscribe if you haven't already so you don't miss future videos where I'll continue sharing practical, science-based strategies for optimizing your health. Share this video with anyone you know who struggles with muscle pain, soreness, or slow recovery. The information I've shared today could genuinely change someone's life, just like it changed the lives of James, Carmen, Robert, Linda, George, Angela, David, and Helen. Thank you so much for watching, for caring about your health, and for taking the time to learn how to better support your body's natural healing processes. Your muscles work hard for you every single day. Now you know how to give them the nighttime support they need to stay strong, resilient, and ready for whatever life brings. Take care of yourself, talk to your doctor, and I'll see you in the next video.